Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about swelling in pregnancy, or leg swelling, or generalized swelling in pregnancy. Now, I've mentioned this topic in various other videos I've made, but this topic seems to keep coming up, and this question keeps up. I feel like I need a dedicated video just for this, okay? So, most all women experience some swelling in pregnancy. It gradually gets worse over the course of pregnancy. So the third trimester is usually worse than the second trimester, and there's just even a little bit can happen in the first trimester. It also increases with subsequent pregnancy. So if you've had, every time you have a baby, your blood vessels dilate a little bit and they don't fully recover, and that contributes to some of the swelling that you might experience. So some of it can be normal and some of it can be of concern. Now, one of the links that we have is with high blood pressure pregnancy or preeclampsia. And for many years, swelling was one of the diagnostic criteria. So part of the diagnosis of preeclampsia was swelling. However, unfortunately, swelling is so common, it's been eliminated. Generally speaking, if you have preeclampsia, you're more likely to have swelling than if you don't. However, there are many women who have pretty dramatic swelling and don't have preeclampsia or blood pressure problems at all. So pay a little bit more closer attention if you're having lots of swelling to headaches. If you've got really bad headaches, we want to hear about that. And also mention that you're supposed to come more frequently near the end of pregnancy to get your blood pressure checks. One thing that really affects all swelling is salt intake. So if you go have Chinese food, eat a bunch of Doritos, eat some pretzels, too much salt, and you're going to have some swelling, and it takes a little longer, a day or two, for that to go away. So pay attention to that. If you're having some generally increasing swelling and your feet are getting sore, or they're cutting into your sandals, for example, a good maneuver that can help relieve that swelling is to get your feet above your heart. The position's called Trendelenburg, so it's a recliner is really ideal. You put your head here, your feet there, go as high as you can. If you have your feet above your heart for about 5 minutes, that can help. If you don't have a recliner, which you probably should get because it's more comfortable at the end of pregnancy to sleep anyway. If you don't, you can use a couch. You put some pillows on your bottom, put your head on the flat part of the couch and your feet on the arm of the couch, and that can, not as comfortable, but that can work as well. Okay, so that will help with swelling. Now, there's something that you want to be on alert for, but luckily it doesn't happen too often, and that's called a DVT, or a deep vein thrombosis. That's a blood clot in your leg that causes dramatic swelling. The majority of the time it's in the left leg, but sometimes it can happen. Probably, I think 75, 80% of the time it's in the left leg, just due to the way your anatomy is. It's not totally symmetric. But that's really dramatic. That's when your ankle is like the size of your knee, and vastly different than the other leg. So there's always a little bit of asymmetry, but if you have a really dramatic increase, be sure, or lots of pain, or you feel a big knot somewhere behind your knee or in your leg, that's something to mention to your doctor right away, okay? Also, if you have some shortness of breath, so the risk of a blood clot, of deep vein thrombosis, is that it will go to your lung and give you something called a pulmonary embolism, which is quite dangerous. Higher risk if you're obese, higher risk if you're sedentary, you don't move around, higher risk if you're pregnant, higher risk with smoking and history, family history, or if you have some other coagulation problem that might increase your risk of miscarriages. Hopefully that's been addressed for you, and a little higher risk the older you get, so if you're advanced maternal age. So bottom line is swelling is common, and it more often happens later on, and a few maneuvers can help it, but we can't totally eliminate it. And if it's cold out, you can wear compression stockings. Those are what's called Ted hose. They go all the way up to your thighs. You don't want the ones that go halfway. And those can help, but if it's hot and humid out, you won't be able to tolerate it. It's something for the cooler months of the year, depending on where you live. So I hope you found all this information of use. Please leave your comments. Thank you.